Andrew Pekosz joins us, and what is so important to understand as we go into a Memorial Day weekend and attempting to understand the stresses on our medical community, that he celebrates a wedding anniversary today, and we're thrilled he would take time out to be with us this morning. Andrew, congratulations to you and your bride. What is so important here is the stresses on an exhausted medical community. How are they doing?
Absolutely. I think, the pandemic itself has been such a focus of the medical community and of people. But we have to remember that there are other things that are going on, other healthcare issues that need to be taken care of. Some reports this week about drops in pediatric vaccination rates are, of course, a concern, because things that are not getting done now will have implications later on in the year, maybe next year and the year afterwards.
How serious is Brazil? I looked at the log glide path yesterday per capita, the wonderful work that the FT has been doing with Johns Hopkins University, and the glide paths of Brazil and Ecuador are really, really grim.
Yes, the Southern Hemisphere is now getting into its late fall, early winter season, so there's been concerns about whether or not the COVID-19 virus would do better in cooler conditions and winter-like conditions. Brazil and Ecuador are having tremendous trouble in terms of controlling the outbreak with huge numbers of cases. Other countries in the Southern Hemisphere have been able to control that with very, very rigid and active surveillance for the virus and testing for the virus. But several countries in South America are a concern, and the emerging problem in Africa is also of some concern.
Are there, Dr. Pekosz, are there enough testing kits in emerging market economies, or is that a worry that we actually don't exactly know what's going on?
Yeah, I think the number one worrying in those countries is the number of tests, and then right behind that is the availability of good laboratories that can run those tests in a timely manner. So those two things combined are going to make it incredibly challenging for some countries to really respond well in terms of the testing, isolation, and contact tracing that are needed to control this outbreak early.
Andrew, what can you tell us about, the end of the lockdown? So we're seeing a number of economies, the biggest economies in the world, reopening, some slowly, some less slowly. But given the time lag of people ending up in hospital, when will we have a better idea of the exact situation?
And this is one of the challenges with this virus, because it can take anywhere from 1 to 2 weeks to show symptoms, and you're infectious for about probably 7 days. The lag between when cases start to come up is significant. You're seeing some small spikes particularly in states in the U.S. that are loosening their economy. Some other states are doing a little bit better right now, but we really won't know until 2 to 3 weeks from now how these states are doing with loosening their public health interventions.
Dr. Pekosz, one final question. I don't mean to be trite about it, but I think it's an immediate question. How safe will the beaches be this weekend? What are your thoughts on heading to the beach?
Well, as economies open up, as some of these social distancing, social distancing should still be in place. So people need to really be careful about keeping their distance among people when they're outside. It's great to get outside, to do some activities, to try to enjoy yourself during these times, but social distancing and wearing masks is going to be an incredibly important thing to do, irrespective of what your activity is. I know it seems a little bit odd to say that on a beach and stuff, but maintaining social distancing is the critical thing as people try to get out and and get back into some sense of normalcy.